Every year, public agencies like Alberta Health Services publish a list of the top earners. This year's list shows more nurses are taking home bigger paychecks. In fact, 982 nurses made the Sunshine List, each earning at least $141,000, and some were making considerably more. One AHS nurse earned over $510,000. That's more than the CEO. Let's look at some of the others. Before 2020, no frontline nurse in the public system was earning more than $300,000 a year. But in 2022, 6 nurses hit that mark. Another 21 nurses earned more than $250,000, a salary that was unheard of just a few years ago. And the number of nurses earning more than $150,000 is more than 5 times higher than it was in 2017.
I don't think we've seen numbers like that ever.
So what's going on? We reached out to several of the highest paid nurses, but didn't hear back. And their employers won't talk about their pay for privacy reasons. Union leaders say the bigger paychecks can't be accounted for by negotiated salary increases alone. But they did give us a list of factors that boost pay. Things like overtime, working in a remote location, working nights or weekends, working in the ICU or on a transplant team, being on call. But they think that overtime is the main culprit. Overtime at AHS more than doubled since just before the pandemic. And why are nurses working so much overtime? Because there's a shortage of healthcare workers. At AHS, about 14% of registered nursing jobs are unfilled, but a spokesperson says they are starting to get a handle on this. In Covenant facilities, almost 11% of RN jobs are vacant, and that's been fairly consistent. And there's a human cost to all of this overtime. Nursing leaders say it's just not healthy or safe for nurses to be putting in 60 or 80 hours a week or more. It could lead to errors.
This is not sustainable for the mental health of nurses. And some would say, I had enough, I'm leaving, I'm going to work as a nurse in another area, or I'm leave the profession.
In addition to trying to find more nurses, Brousseau says the province has to hang on to the nurses that it has. And it'll be important to keep an eye on these high salaries too, because they could be an indication of burnout. Janet French, CBC News, Edmonton.